Traditionally, with conventional medicine, health has been viewed as relating to individuals, their burden of disease and their level of physical and mental well-being. A couple of centuries ago, with the onset of industrialisation and large cities, the field of public health developed, and that focused mainly on specific populations and the causes and prevention of disease at the population level. And it's only been over in the last 2 decades that there's been increasing awareness of the idea of planetary health. And this is an area that's new to pretty much all of us. Planetary health has been defined as the health of human civilization and the state of the natural systems on which it depends. The world's first planetary health professor at the University of Sydney, as we've talked about, Tony Capon, says that planetary health is about safeguarding the health and well-being of current and future generations through good stewardship of the Earth's natural systems and by rethinking the way we feed, move, house, power and care for the world. So as some of us already know, we're now in a new geological era, the Anthropocene. Humanity's impact on the Earth's natural systems is enormous and accelerating with our growing population. Really, every aspect of human culture, we're now coming to realise, has had an impact on the planet on which we live, and everything is connected. What we do on the Earth comes back to affect us, and sometimes these effects are unexpected. Just one example, there's clear evidence of recent declines in both wild and domesticated bees and other pollinators. And as expected, there's parallel declines in the plants that rely on them. The potential drivers for pollinator loss include habitat loss and fragmentation, the use of agrochemicals, the introduction of pathogens, and the introduction of alien species, and of course, as always, climate change. All of these interact in very complex ways, and the different issues are more potent in different situations, but the overall trajectory of loss of pollinators has really quite devastating implications for agriculture and biodiversity in general. So that's just one aspect, and Kim's going to talk to us about others.
So we can see in this intersecting with a Venn diagram, have an idea that everything affects everything else. So everything that humans do impacts on the environment. I'll give you examples of this close to home. In Western Sydney, we've had the hottest summers, and within Penrith, in the last summer, the over 40 degrees in heat for over 4 days. Western Sydney is an urban island with heat effect. And in the end, we also then use more air conditioning and utilise more energy. And in New South Wales, 80% of our energy is generated through black coal. Another example where we're beginning to look at disease in the systems pattern is with infectious diseases. Because with the movement of people, domestic animals, and vectors, it's a strain on the ecosystem of most environments. And at the moment, there's very few programs that overlap human animal health, nor do they incorporate social, economic, ecosystems expertise. And in combating infectious diseases requires that. And the 2014 Ebola outbreak is an example of where we need to understand the mechanisms of the outbreak better. In Australia, we have diseases like Ross River fever, which were previously in Queensland, and we've had cases in New South Wales. And it's debilitating. One of my patients, and I live in Riverstone, I mean, I should say I don't feel so live in Riverstone, that's where I work, but I've had a couple of patients with Ross River fever, and it wasn't heard of a decade ago to have Ross River fever, which is a viral disease that causes generalized fever, respiratory symptoms and aching joints, and it can cause tiredness for several weeks. Now, an interesting thing I uncovered, which I might just bring up, is that there's also been a study that our adaptation for drought, having more water tanks within our homes, has also theoretically also increased our mosquito populations with tanks that are unsealed. So And there was a study that was in Australia 2 years ago about the risk of dengue increasing with unsealed water tanks. Another area that has been researched for quite a while now is to do with emissions from cars on the effects on people of dementia. In 2017, in The Lancet, a very large study was carried out in Canada where they, what can I say? I've got this all on my iPhone. the study was carried out in Canada with a large population that were living close to heavy traffic. The individuals in the study were assessed according to proximity to the major roads. Then the association between traffic proximity for the incidence of dementia, multiple sclerosis and Parkinson's were assessed. And the conclusion was that there was a higher incidence of dementia for the population living closer to heavy traffic. Another study which was carried around in 2009, and that was published in Scientific America, showed that pregnant women who lived near congested roads had a higher incidence of babies born below 30 weeks, and this was an increase of 128%. And the USA actually have tighter emissions regulations than Australia, because I found, then I researched further, and there were more studies that were done in America in sort of between 2005 and 2010 that indicated that there were, to actually substantiated the findings in these studies. So within our society in Australia, we have pretty much no emissions targets that would reduce our emissions to a level where it wouldn't affect our health in Australia. Any questions from that point?
We might continue.
Yeah, continue.
Yep. So really, I think one of the points is that there's no doubt that we've made really great progress in improving human health and well-being over the last couple of centuries. So we've improved life expectancy and reduced the burden of diseases, improved the length and quality of life for millions throughout with our ingenuity and our scientific endeavour. But the problem is that our current material wealth, possessions and comforts, although they'd be unimaginable for generations past, they are actually at the cost of our planet, essentially. So the progress that we've made has affected our planet in many ways. We are degrading nature in ways that are actually undermining our well-being. So we measure this degradation in many ways. For example, carbon dioxide in the atmosphere, as we know, has risen to above 400 parts per million for the first time in human history. The acidification of the ocean caused by that carbon dioxide profoundly affects the ability of sea creatures to form their shells and skeletons. Our use of energy to fuel our lifestyles has skyrocketed, though most of this energy still comes from non-renewable sources. And we're still clearing forests, especially tropical forests, although they're vital as storers of carbon, as providers of clean water, as habitat for precious plants and animals. And we're using more and more water and fertilizers and land to produce food for our ever-increasing population. But damaging the planet damages human health. At Citizen Climate Lobby, we're well aware of the effects that burning fossil fuel has on the climate, and we know that the effect of extreme weather events and heat waves has quite profound effects on our health. There's a loss of biodiversity, and that's another way of saying that we're losing elements of the web of life that sustains us, and as well as sustaining other plants and animals within it. Biodiversity provides important resources for medical research and development of innovative medications. It allows us to have a diverse set of crops, which improves nutrition through the provision of a variety of food sources. And the genetic diversity in crops allows crop development and improves food security. So climate change and other causes of environmental damage mean that by 2050, 40% of the world's population are expected to live in areas of severe water stress. This and increasing soil degradation mean millions will be at the risk of undernutrition. So the question is, what can we do about this?
Well, it's to learn about planetary health, which we are currently learning about ourselves as doctors. As doctors, we're trying to engage other doctors to be more aware of the impact of health and the environment, which is what Citizens Climate Lobby, with integration with Doctors for Environment, we're trying to spread the word, and to reduce food waste. And really, as a general practitioner, I encourage my patients to actually have chickens and have gardens to actually improve their health, so that there's a smaller carbon footprint for their food. And to eat less meat, as in Australia we clear more forests within Queensland than what Brazil clears in a year, and it's appalling. And so I really encourage, and there's evidence that eating less red meat also reduces your risk of bowel cancer. So as doctors, it's so important for us to encourage a healthier diet, so that it has a lower environmental impact. And better governance. Better governance is probably one of the most difficult things to actually encourage, and really is a part of a citizens' climate lobby if we're looking at better governance within the government itself.
So the other things that we can do, using water more efficiently. The supply of fresh water that supports human health and enterprise is basically constant. It represents only 1% of the water available worldwide. Irrigation accounts for about 4/5 of the total fresh water consumed. So things like using drip and trickle irrigation systems, although more expensive initially, because they use a third less water than traditional methods of irrigation, they're actually very useful to invest in. And then there are things like developing crop types that require less irrigated water by maximising their growth through periods of natural rainfall. So there are many ways that we can actually reduce our water usage, especially in agriculture. Ending deforestation is actually a very important thing as well. Deforestation and forest degradation accounts for approximately 17% of carbon emissions, more than the entire global transportation sector, and second only to the energy sector as a source of carbon emissions. So one way of tackling this is the REDD+ United Nations initiative, and this stands for the Reducing Emissions from Deforestation and Forest Degradation. So this is a program that creates a financial value for the carbon stored in forests by offering incentives for developing countries to reduce emissions from forested lands and invest in low carbon paths to sustainable development. And of course, as we know, in our own backyard in Queensland, changes to government regulations can make a profound effect on forest clearing as well. One area that I'm quite passionate about being a GP is family planning. So population growth is probably the biggest driver of increasing scarcity of resources, land degradation and climate change. Yet it is estimated that 225 million women worldwide who would prefer to avoid a pregnancy have no access to good contraception. So provision of family planning services universally in developing nations is absolutely fundamentally important. In developed nations like ours, individually choosing to have one less child is the biggest way by far to reduce our individual carbon footprints. Marie Stobbs International estimates that 50% of pregnancies in Australia are unplanned. Not necessarily unwanted, but certainly unplanned. And as a GP, I now try to ask my female patients of reproductive age the one big question. And what is that? It's, do you want to have a child in the next 12 months? Providing effective, acceptable contraception to the women who say no to that question is the biggest way that I can help to minimise climate change. Then there's city planning. Urban planning decisions can impact on the environment in many ways. We know, of course, that the provision of adequate public transport, footpaths and cycleways allows individuals to choose more easily to leave their car at home and in any one given trip. Councils can lead by example, using solar panels on their council buildings, using electric vehicles in their council fleet and providing recharge stations for electric vehicles. And the provision of green spaces decreases the urban heat island effect that Kim has talked about. It also sequesters carbon and has the important effect of improving mental and physical health and well-being in the population. there's growing evidence that the importance of access to green spaces minimises anxiety and depression in people and decreases behaviour problems in children. It's actually been shown that a 20-minute walk in a natural green space has improves concentration and attention in children with ADHD and adults with ADHD, and probably all of us. So, so it's very important to have that provided. And finally, I wanted to actually introduce the idea of the Sustainable Development Goals, which are from the United Nations. So on the 1st of January 2016, the Sustainable Development Goals of the United Nations 2030 Agenda for Sustainable Development came into force. So it was adopted by world leaders in September 2015, and that included the Australian government. These goals are wider in scope than the preceding Millennium Development Goals, because the Millennium Development Goals only applied to developing countries. So these Sustainable Development Goals actually apply to all countries. These 17 goals provide a framework to improve human health on a global scale while improving the health of the environment, thus achieving better planetary health. The work of Citizens Climate Lobby directly relates to Goal 7, so that is affordable and clean energy, and to Goal 13, which is climate action. But as we've seen, our work on climate change impacts indirectly on almost all of these goals. So I think it would be useful to be aware of these goals when talking to federal politicians. So in conclusion, I think Tony Capon, again, our lovely professor of planetary health, says that human culture is the cause of many of our problems, but human culture has to be the way out of our problems. I believe that we can improve the situation, and our work in Citizens Climate Lobby is an important part of the solution. And to end with a useful quote, never doubt that a small group of thoughtful, committed citizens can change the world. Indeed, it's the only thing that ever has. And that's from Margaret Mead, a wonderful anthropologist.